our series, Conversations on Spirituality, Faith, and Health. I am Ann Cottingham, a health services researcher with IU Health Evans Center for Spiritual and Religious Values in Healthcare that is directed by Dr. Lexi Torkey. The Evans Center and the IU Health Chaplaincy and IU Health Spiritual Care all co-sponsored this conversation series. I'm joined today by my partners in this work, IU Health North Chaplain William Taylor, who's Director of Spiritual Care and Chaplaincy Services in the Indianapolis suburban region, and our colleague, Gloria Robertson, also with the Evans Center, who will be directing the administrative portions of this program. We're also honored today to welcome 3 members of the Burmese community. And so at this time, I would like William and Leon, Justin, and Rosie, if you would please all introduce yourselves.
So, Ann, thank you so much. I'd like to say, first of all, to our panelists, it's so great to see each of you. We've had wonderful conversations in the past, and I'm looking forward to this continued conversation with the larger community. Throughout this conversation, I probably will refer to you as family. We all belong to this human family that expands throughout the entire world. But when we have conversation with each other, when we sit down and authentically listen and engage one another, we recognize that they are us and I am them. And so I'm looking forward to this conversation. One thing that we say within healthcare, particularly here at IU Health, is that we seek to provide the best care designed for you. And if you think about that, that word design has a lot to do with building. And we can't build healthcare in the lives of another person unless we understand them, unless we walk with them and really begin to listen to their concerns, to their culture, ways in which they communicate. So I'm trusting, Ann, that we will have this conversation today with our wonderful colleagues. So I'm so happy to be here today to join with you and our wonderful panelists.
Thank you.
I think I can go. Thank you, Ann and William, for having us for this wonderful conversations. My name is Leon. I'm with the Burmese American Community Institute. I have been with this position for 11 years. So hopefully, I can make some input to the fruitful conversations. The Burmese community is about 27,000 in central Indiana. And with the Burmese American Community Institute, we have been assisting with the programs addressing the needs of the Burmese community in central Indiana. We do, everything is educational. Our vision is education for all, a stronger community. So we went and invited this opportunity to share with you all. We are very excited to be a part of this. With me, my colleagues, the Justins, one of the youth leaders here, our community leaders, and as well as the Rosie, one of the expert and youth leaders in the community. So yes, I'm looking forward to the questions, fruitful conversations that we will have, and hopefully we will be able to answer all of your questions. But if it's not, we are always available to help and be resourceful to you all. So with that, yes, it's a pleasure. My name is Leon, and yes, it's a pleasure to be here.
Thank you.
Zhang, you want to go first?
I think you can go first.
All right, thank you. Good morning. It's still good morning, right? Just have to make sure. Good morning, everyone. I am very excited to be here with you virtually. I am very looking forward to share about what I've been through, what my family been through after we arrive in this great, amazing country that we love, but due to cultural issue and cultural shock that we've been through, or the places that where we come from, we face so many struggle until today. So I would love to share with you about my personal story, our community story, and in general speaking, what Burma is about when it's come to healthcare system. And my name is Justin Tang. I am the founder and executive director here at Hope for Tomorrow. This organization was founded in 2017, and we have after school program for K to middle school. We have around 100 students right now in our program, and we have English conversational class that we just started this year. So this is their 9th month. So the course lasts for 9 months, and they are going to graduate this month. Very excited. We have around 20. We started with around 30 students for the first group, and we ended up around 20 who will finish 9-month course. And when they first come in, they were so shy, don't even know how to introduce themselves. But after 9 months, when they walk into our building, they say, "Hello, sir. How are you? How was your day?" That is what we're doing here at Hope for Tomorrow. So I'm so excited to be part of it. And also we have citizenship classes for our Burmese adult. And by the grace of God, in the past 5 years, we have more than 300 adults graduated and become an American citizen through our program. So we are so grateful for that. And the last program that we have, except for summer school and other alternative program, we just started Hope e-learning due to Burma situation, due to military coup that took place last year, back in 2021. All of the students in Burma lost their education access for, this is their 3rd year, 3 years. So we try to come up alternative program, and we started online class. So we have around 250 students from Burma joining our program and learning English virtually. So we are so grateful for that, even though the country keeps cutting off, the government, the military government keep cutting off the Wi-Fi access, internet access. They find a way to attend the school, the class that we offer. That is kind of mixture feeling for me. I'm glad, but I'm so sad, to see this 15 million plus student lost education access. So today I will be here to share about our story and answer some of your questions. I'm so excited to be here, and thank you so much for having me.
Thank you. Rosie?
Yes, hi everyone. My name is Rosie, and I'm also with Burmese American Community Institute, and I work closely with high school students. We have after-school program. We have about over 100 over students, and also I help out with citizenship class with adults. So yeah, and today I'm excited to share, like Justin and Liam mentions, how we've been going through and shift of culture and how Burmese community experience back in the country and here. So I'm excited to hear all the questions. Thank you.
Wonderful. Well, we thought maybe we would kick this off by sharing a little information about the experiences of members of the Burmese community back in Burma, what that community is like, the diversity of the community, and then the journey to the United States and some of the challenges here. So I will let you all pick that up.
I think yes, maybe I can start a little bit, and my colleagues can add on to the information that I will be sharing. The country, Burma has been under military dictatorships for quite some time, since 1962. And the people, especially the ethnic minorities and religious minority, has been targeted for with persecutions and suppressions and human rights violations. So people had to seek protections and then freedoms, They're to seek freedoms to different countries. And that include the United States. United States generosity has been, well known all across the world, and which the Burmese community is also finding that generosity here. We have the the Burmese is very diverse. We have the 8 major ethnic groups: Kachin, Gaya, Kayin, Chin, Bama, not to be confused with Burmese, and Mon. Wait, I might have skipped a couple. Let me go back. Kachin, Gaya, Kayin, Chin, Bama, Mon, Rakhine, and Shan. And even within those, those 8 ethnic groups are quite diverse itself, and even within the 8 major ethnic groups, there are 135. That's, quite diverse sub-ethnic groups within. So just to give you one example, the Chin, for instance, which is one of the majority ethnic groups here. Back home, Bama, the Burmese, will be the majority ethnic groups in Burma. But here in central Indiana, I think Chin will be of the majority ethnic groups, but we also have so many different other ethnic groups presented, or pretty much all of them presented here in central Indiana. The the process is pretty much, seeking protections. Usually, the immediate country will be of Malaysia or Thailand or India. And then from there, the background screening, health screening, those will be conducted there. And after that, everything is good. The resettlement sponsorships and things like that is in place, and then the refugees will be resettled into United States. So instant, for the Burmese community here. And once arrive here, usually in central Indiana, we have two resettlement agency. We have one is the Catholic Charities, and the other is the Exodus refugee resettlement. So they have done phenomenal jobs, in assisting refugees in adapting into a new community. And next steps, like us, from the community, the Burmese American Community Institute, Hope for Tomorrow, and a couple local nonprofit organizations also step up to assist the community. So you might be asking why the Burmese community come to United States. I think it's the simple, we can go back to a long history, but I don't want to bore you with all those, historical things. But I think I briefly touched on it on the beginning, that, the dictatorship has, targeted a lot of ethnic and religious minority. Not just that, the people of Burma, including of the Bama ethnic groups, which is the majority in Burma, suffer so much. And they had, expressed their rights, and they expressed their, freedoms, right? And, or demand for freedoms and rights and protests, peaceful protests. And they were brutally, attacked and targeted by the military with the guns. As a result, they had to seek protections, which is the definition of refugees. And because, so that's one reason that, people of Burma will be relocating away from Burma. Another is, political participations. For instance, what's happening now, the military coup happens, as Justin has mentioned. They, anything against opposing the military agendas being targeted, and a lot of people are imprisoned or arrested or even executed at this moment, which we will kind of briefly touch down the road if you are interested. If there's a question related to that, we can. So those will be some of the reason why the people fled the country, and the root cause of the conflict and the root cause of the refugee resettlement. So, that's a very, very kind of brief. I want to be respectful of my colleagues here. If they want to add something. Justin, Rosie, do you want to add something?
That background is amazing already to me. I will not add more on that.
I'll not add more to it. So.
Okay. And should we continue or how?
Thank you. Yes, we'd love to hear a little bit more about your story. Maybe some of the religious background. What are some of the different religions that individuals might have here? Maybe both in Burma and here in Indiana. And then some more about your experiences now that you're in Indiana, that you, family and friends have had. What is life like? What is your experience with healthcare like? I also wanted to share with all of those who are joining us today, if you have questions or as you have questions, please feel free to put those in the chat. William and I will be monitoring the chat box, and then we will bring your questions up as appropriate during the conversation.
Okay.
So thank you.
All right, thank you so much. Before I share about the healthcare, challenges that I personally face, and then my family or as a community, I would like to mention that I used to be one of the interpreter at IU Health, and also work with HealthNet. And after being interpreter, I become administrator, and now I become board of director for HealthNet. So I've been in healthcare system for 10 plus year, as soon as I graduate high school. So I mean, before I graduate high school and after I graduate high school. So I will speak from that 10-year experience that I have in Indianapolis when it's come to what our people face and what I witnessed and what I personally went through. So the first thing that come up in my mind when I saw the poster about this event. Now I love that. I really love it because that made me excited to come here more. The reason why I'm saying that is because, every time when someone try to, display Burma, you will see like pagoda, right? Pagoda, Buddhist monk, or something like that. That is what people think. And then when we talk about China, right? What come into your mind right away? Like maybe the Great Wall, or like whatever. And then whenever you talked about what is that, like some place that, for example, I don't know, maybe Florida, you'd start thinking like the beach, and then all this palm tea and stuff, right? We always have like something that come up in our mind right away, or imagination right away when we heard something. So that is what I'm excited more about this conversation, because like the people who live in Burma, as Mr. Lian mentioned earlier, we are like about 50 plus million live there, and 94, 95, 90 plus, I would say the service wanted to say 90 plus people, 90 plus percent of the population are Buddhists, which is correct. And that's why when you talk about Burma, when you talk about Burmese, when you try to bring something related to Burma, that pagoda, that Buddhism is kind of like part of it right away, which is okay. But when you don't really have connection or don't have a chance to dive in a little bit deeper, that's how you will stuck, or that where you will stay. So the reason why I say that is because right now, as Mr. Lian mentioned, majority of the people from Indianapolis who from Burma are the Chin, exactly the same spelling as your chin, 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 not China, not Chinese, the chin, chin. We are from Chin State, one of the state of the 14 state, easiest way of saying 14 state, and we are just like 500,000 people. And you know, we are, I will say 80 to 90% of the population from the Chin State are Christian. So you know, now we have around 90% of the people who come from Burma who live in Indianapolis are the Chin. So you can see the people who live in Indianapolis from Burma, majority of us are the Chin. And Chin and Christian. So when we just use that kind of display, it's just okay, but a lot of the time we will not have connection to that. So all of you are healthcare professional. So I think this is something that I would love to share. And then of course, please do not misunderstand, because we have Buddhists here, Buddhists who practice Buddhist, who don't have any religion from Burma as well. But you know, generally speaking, 90% of us are from the Chin State, Christian. So that's why I think when it's come to healthcare, a lot of time, you know, instead of just assuming this patient background, or you know, just conclude yourself because this person from Burma and 90% of people are Burmese, Buddhist, you know, instead of just assuming, asking a question is totally fine. Like, how do you want to address? How do you think about this? I know, like, most of the time the doctor and the nurses only have 15 minutes window. I understand that. I get that. I've been there for 10 years with you. I totally get it. But sometimes I think it's safe to mindful. That is one thing that I want to mention before I say anything. I'm sorry, that's quite long already, but I hope you do understand me. So the second thing that I want to talk to you and share with you about is that, you know, a lot of the people identify themselves in so many different ways, due to what, you know, Mr. Lian mentioned, that we have over 100 plus dialect in Burma, and we have 135 different ethnic group or tribal there. So sometimes people don't want to get called by this and that name. So sometimes, you know, we have Kachin patient, we have the Karenni patient, and we have Karen patient. So it's so confusing. Karen and Karenni are totally different. So if you just put I after the N, that's totally different people of group people. And then if you just remove the I, then another person again. So if we don't sure about what type of, you know, what group of people they belong to, it's okay to ask them, like, okay, what part of the Burma you come from? What language you speak? That is the safest way of my 10-year experience to ask them. When you ask them what type of Burmese language you speak, or what part of Burma you come from, they will say, oh, I'm from Chin State, I'm from Kachin State, Karen State, or I speak Chin, Hakachin Phalam Chin. That's more crazier too. And then, you know, they will tell you. So I think that's how you will start building relationship with your patient, because a lot of time, one I heard a lot from our patient, older patient, is that, oh, you know, I've been called by this and that. I'm not comfortable with this doctor because she used this and that word. Because the doctor don't know. The doctor only have 15 minutes window. The nurse only have 15 minutes window. And they have like how many patients that you have to see in a certain hours. So it's not your fault. So I think the safest way is just asking them a question, how they want to be addressed. That is something that I want to throw. And the third thing that I want to mention is that I want to give you a good example. I was like 20 back then. It was like my second or third year of being interpreter. So I was still nervous, you know, like I don't know so many you know, medical term. You know, I have like my book that, like, I don't know how many people do it nowadays, but I have like my dictionary with medical term. Like I was standing ready to translate. And you know, it was we don't have enough female interpreter back then. So I have to go to a female room, OBGYN. So I was standing there, and then she only have like 1 month or 1 week, I forgot, I'm sorry, but she's about to give birth. And then the nurse and the midwife, they go over all the things that she have to be careful and have to follow some guidance. And she said, no breastfeeding. No, I don't want to breastfeed my child. And forget about how the reaction the midwife said. I was like, why? But I'm not allowed to say that, of course, I'm just interpreter. So I translated why, not why, but I translated to the provider. And then she said, why? And I translated. And she said, oh, because, look at all American children, nobody breastfeeding. They just use like formula, they give formula, and look at them, like they're like 6 foot tall, 5'8", 5'9". If I give my, she was like, we are Asian, and then of course, she's very tiny woman. So she thought, if she breastfeeds the child that she will give birth, that child will be very small. That is just our lack of knowledge. Don't know anything about the good, like how much this breastfeeding is gonna benefit to the kid. But she just assumed, seeing all the most American children only being formula, she thought that if she breastfeed her child, her child will be very small. So for 15-minute, 20-minute appointment, it took 2 hours. I have to go up to another place, and we have to call another nurse and try to explain everything. So that is the reason, a lot of Burmese patients are lack of knowledge when it's come to healthcare, because we don't have those kind of education background when it's come to healthcare in Burma. And then one time, my mom, her feet were swollen. Her feet were swollen, and then I knew that is normal. That is not normal. And I asked her, okay, let's go to emergency. Let's call your doctor office. And she said, no, I can handle this. This is okay. I said, Mom, swelling feet is not okay. And she said, no, I can still bear with it, right? It is still not, killing me yet. So I said, no, Mom, you have to go. So I kind of like dragged her and then took her to the hospital, ER, emergency, and found out that it was her diabetes. That is so scary. But she refused to go to the hospital when we first arrived in America, because back home, they don't have that kind of culture. In Burma, especially where I come from, it's called Phalam town. In the whole township, we have over 50,000 people. Then we only have one hospital. One hospital, 2 to 3 doctors, and 50,000 people. And then if you don't, have enough money, or if you don't, consider it a certain, group of people, you will not be able to go to that hospital. So that's why a lot of Burmese, the Chin, will rather stay home and deal with, face the pain instead of going there. So that's why even though they come to America, they don't have that culture. They've been with that kind of, experience and culture for majority of their lifetime, like over 50, 60 years. So when they come to America, even though they've been here 5, 10, 20 years, they still not used to this system that we have. That's why you will see a lot of your patients who from Burma, they come to you very late, because they don't know, the importance of going to the doctor when they first see the symptom. That is the second thing that I want to mention when it's come to refusing going to clinic or hospital. And most of the time, they scared to go to the hospital. One time my cousin, she gave birth, my beautiful cousin named Jessica. She's in our after school program right now. She's 9 years old. She's very sassy. She loves, being dressed up like princess. One time, before she was born, her mom, we went to Methodist, and then she was crying. Her mom was crying very bad. And I said, why you keep crying? I know like you are pregnant and sometimes it's normal to cry as a mother. Why you keep crying constantly? I kind of worried. And she said that I am so thankful. I said, why? I mean, I know that you're going to give birth. I'm so thankful too, but why you have to continue? You have to keep crying. And she said that I cannot believe myself that I am giving birth in America. And I was like, what do you mean? You live in America and you are going to give birth here at Methodist. And she told me that if I live in Burma, I will never have a chance to give birth in the hospital. A lot of time, I'm sorry, I don't know how many nurses are there, but in Burma, you got yelled by the nurse when you wake them up in the middle of the night. Sometimes they will come and tell you like, don't call us until the next morning. That's what the nurse will come and tell you. So even though they stay or they have enough money to admit in the hospital, they still live in the hospital with fear. That is the system that implemented by the Burmese military, the Burmese government for so long. So that's why when we come to America, we are confused. We are not used to the care. We are not used to the love that we've been received by the provider. I got all emotional all the time when I talked about it. We are not used to this good healthcare system. I know a lot of people keep complaining about American healthcare system. I know I get that, but someone who comes from that world country, who was a refugee and who come from Burma, I can tell you, this is the best healthcare system that our people ever been, experienced in our whole entire life. So that's why you will confuse a lot of time. People will not take their medication regularly, and sometimes they will just say no. And a lot of the time, people try to lie to the doctor, or a lot of time they will not tell everything to the doctor because they said they feel sorry to tell everything. That is what I experienced. They have like back pain, they have like like swollen hand, or sometimes they have like knee pain, and they come to the clinic and they tell everything to us because they are familiar, and then they're comfortable with us because we look like them and we speak their language. But when the doctor really walk into the class and they say, oh, just my knee, and I said, what, where's the other 3? And they said, no, it's okay, just do one. I'm like, no, because they're not used to this kind of healthcare system. So I'm asking today, I'm going to end now, I promise you. I ask you to be patient with us. I know you've been patient with us for so long, but due to the system that implemented by the military government for so long, their whole entire life, over 70 years, the way we see healthcare, the way we've been treated, the way we've been educated when it's come to healthcare is very behind. So that's why you will confuse a lot. But if you ask us patiently, and if you ask us the right way, I promise we're gonna open up, we're gonna come to you, and we're gonna share with you about, what we've been dealing with our health challenges. So thank you. If you have any more questions, I would love to answer it. And if you have other questions, I'll be able to answer next time as well. Thank you. Sorry, it took forever.
Justin, I thank you for your passion. You said a lot to us. And one of the takeaways from me is that the knowing and learning the identity of our Burmese community is vitally important. And earlier was mentioned that there are 135 ethnic groups, and there are 8 specific groups. And even if we call an interpreter, does not mean that the interpreter will be the exact one or what's important for that patient. So we really have to drill down, build the relationship with that patient, hear the story. But I think what I just heard you say is the context is is telling is that for many of our Burmese community, there is a militaristic context that is in the backdrop. And oftentimes there is trust, the lack of trust going forward with healthcare. And then I heard you say, please have patience with us. There is a question that I want to share as we go forth. There was a thank you, Lynn and Justin, for sharing your experiences. More specifically, it said, how can IU Health community outreach and engagement support the Burmese community outside of the walls of the hospital? That's one of the questions from one of our participants.
I think I can initiate. Yes, we are located not very far from Indianapolis, and we have worked with several projects with physicians and local clinics and even hospital to project like this. So I would say get involved in visit the south side of Indy if you haven't been so, and and please visit our office. And as Justin mentioned, we have each of our organization has programs that to address these to assist the community members as they integrate to the community. Just as mentioned, a couple of programs, and for BCI, we have the integration piece with the vision of education. We rely heavily on, we all rely heavily on community service and partnership projects and volunteers. So please, reach out to Anne, reach out to William, or any of, or even your patients, right? For Burmese restaurants, which we do have a lot, and also the religious congregations and so on, or culture event. We will have two big one in terms of the community in February, Myanmar Union Day, and also the Chin National Day. It's very culture rich event to really get connected with the community. Yes, but there are also others event and projects and activities that we would love you all to be a part of. And yes, Justin, do you want to add something?
Oh, yes. It was, I really would like to add the, like involvement. Yesterday I have a meeting. We met Perry Township superintendents, and he said, like, how can the teacher, involve more in the community? I said, okay, come out and then, come out, and then involve. That's the only way. So, I really love that question. Thank you for that question. One of the example that I can give is we used to have nurse practitioner, one of the nurse practitioner from one of the provider volunteer at our program, our citizenship class. And then, she always wear her badge when she come to our program. She just do interview, practicing their conversation, boosting up their confidence level for, the interview. It's just so easy. Like, how are you, where you come from, basic information about them. And then majority of our our client or student are, they barely know how to write their name. So sometimes they have to be in the program for 1 to 2 years for them to pass a US citizen, plus paying the fee, almost like $1,000 to become a US citizen. So that took a long time. So that's why we brought, outside volunteers. So she's from community, and she come and help, a couple nights. And then she always put her badge, as I mentioned, with her name and then her, the hospital name. And after 2 months, this is so excited to say, after 2 months, they start asking her a question related to healthcare. They come to the classroom just to practice English, but now they know what her expertise are, and they know where she come from. And now it took 2 months to build that relationship and trust, but now they start asking some questions. Some parents, adult women start asking about women health, start asking them about, like should they go for this and that certain thing. So I think like involvement is very important. So like Lian mentioned, ABC, BACI is one of the, I dearly love them because, this organization, especially for higher education part, and then, other program, one of the leader, organization that we have. So they have high school kid, I have middle school kid. So, mine is more crazier than them because they are a little bit younger, but you can always reach out to them and see how you can volunteer there. And I'm here. We have adults for English class, citizenship class, and after school. So please come and volunteer or learn more about us. I promise, if you have a chance to connect to them personally, they will, be able to open up and share and ask questions. And then one last thing, that that student from that class, I found out that they become a new patient over there. Okay, so this is not good to say for me, but I don't know wherever they used to go, but I found out after 6 months, now they trust this person, they can ask a question and they're comfortable to go see her as a provider. They switch from somewhere else to there. So that is something that I would like to mention.
Thank you, Justin. That's very, very helpful. Rosie, I would love to hear a little bit about your thoughts and your experience.
Adding to the questions, so some ideas that I can give is collaboration is very important. So you can always reach out to Hope for Tomorrow with Justin, or Burmese American Community Institute with Lian, or also we can also reach out to churches. So that's where Burmese like adults, parents, goals, and you can partner with pastors and, come up with some idea like 2 to 3 workshops that related to health topic. Just like Justin mentions, most of the adults, they have this fear in them where they can really open up when they went to see their family doctor or nurses in hospital setting. But when provider come to their location or their place, this is where they are more likely to open up and want to learn. And I myself is a graduate from public health. So we learn about populations, we learn about community related to health. So far what I see is in our Burmese community, we are lack of many knowledge. And there's so many things we have to learn, and we cannot do this on our own. We need help from providers, nurses, like Justin mentions. If this is hard to initiate from us because sometimes we are lack of resource and idea, but if the provider or nurses can reach out to us and collaborate with any leadership in the community, that's include with church and nonprofit organization, that will be great. And also, yes, first of all, I'd like to say thank you to all providers and nurses. You guys are doing incredible job for the community, but at the same time, education is always learning. It never ends. And I have few friends who are in nursing program, and I have witnessed myself how they work hard for the community. But like Justin and Lian mentioned, for me, this cultural diversity is becoming increasingly more important in the workplace. Especially, it is particularly true in healthcare organizations facing demographic shifts in patients served and their families. And for example, for instance, patients may present their symptoms quite differently from the way they are presented in medical textbooks. And some patients may have limited English proficiency, and of course, different threshold for seeking care or expectation about their care, and familiar beliefs that influence whether or not they adhere to providers' recommendations. So leadership is very important. like I mentioned before, I have seen many Burmese community students involving or majoring in going for doctors or nurses, which is very helpful because uh, from myself, including my mother, she is 50 years old, and I have few relatives, adults. Every time I take to for their appointments, they have this feeling of fear in them. They just don't feel uncomfortable in hospital setting where they don't see familiar faces like us, like so they're like, no, I don't want to go. And especially a few barriers that I can mention is women tend to not drive. So even if they have appointment, let's say here the husband they work day shift, then even if they have appointment, if nobody follow them, they will not go on their own. Even if they drive, they will still decide not to go to the appointment. They're like, it's fine, today not seeing the doctor. It's fine. It's not going to happen anything. So they decided to not go and stay home. That's one of the barrier. And like I say, even if they go uh, hospital setting, like Justin mentioned, I really like about that is back in Myanmar, we have only one hospital and it's like just one room, one doctor in there with 3 nurses to assist him. But here the hospital is really big, like 10th floor, 4th floor, so many places. And this kind of uh, make the Burmese community to have fear in them, not to go and see the doctor, so many things. Yeah. So back to the question, it will be great if providers and nurses can collaborate with Burmese community because the government and the nation is doing so great, such as offering Medicaid, Medicare, and many other health benefits. But many of Burmese community are not aware of these benefits that can assist them to have a better, healthier lifestyle. So we cannot do this on our own, but if the providers and nurses can collaborate with us and go over topics for 3 weeks workshops or 2 weeks workshop or 1 month workshop, this will be very helpful and open up minds of Burmese community. Yeah. Thank you.
Yeah, Rosie, as you were speaking, I was thinking about just the nature of family relationships and how family is so vitally important. Can you speak to us about that patient who may be reluctant to come to the hospital and how we can partner with the community so that one, we can have conversation with the reluctant patient, and two, begin to address the barriers that might be there for the patient coming into the hospital. If you could speak to us about that.
So back to that question, what Justin mentioned, I really like that point because one barrier will be language, which is majority of the population doesn't speak English. So that is one major problem. And another is like distance, driving. Most of the parents, they know how to drive, but because of language barrier, they don't even know how to look at GPS to go to their destiny. Those things. But what Justin mentioned, going back to him, if the nurses or providers started to involve and trying to know the communities, this is where trust build up. And the Burmese community will likely to understand and likely to learn more about American health system. And one of the example that I can give is there is a Indiana member credit union bank next to my house, and both my parents, my family have their debit card, create their debit card in there. So back in the days, we don't have any Burmese people working in there. So it was all American. And I always have to follow them, make my time and follow them to assist in which needs they help. But later on, we start seeing one of the Burmese young men working in there. So that's where my mom was like, oh, this time you don't need to follow me. You know, there's one Burmese guy and I can just walk in there and then talk to him because he speak Burmese or he speak Hakka. And I feel so comfortable and I can drive myself there and get all the help that I need on my own. I'm like, oh, that's great. You saved my time and I can go to work today. I don't have to take day off. So this is one example that I can give is if we can see more of Burmese people work in health setting, more of like Burmese parents were likely to go there on their own and with comfortably. So when they see familiar faces who speak same languages and who understand them, who truly understand their background and have same relationship, they will be more likely to go there on their own without need help with their daughters or sons. So, and also like just to mention, if providers and nurses can come to Southside where most of the Burmese population, they're like, oh, they're interested in us. And it shows that they really like us and they really care about us. And that's where they really want to open up and start asking questions. Because like just mentioned, majority of women in Burmese community, they have so much question that they really want to ask, but at the same time, we cannot really answer to many of the questions they have. But like just to mention, those are like step by step where we can start promoting or making awareness to Burmese community.
Thank you, Rosie. So you all have talked about the importance of trying to help patients and families feel comfortable when they're interacting in a medical situation. Do you have any thoughts about ways that our clinicians can reach out to members of the Burmese community? What would make them comfortable, or what kinds of approaches might they find off-putting that might be a typical way of an American greeting or something? Do you have ideas about what might be the best approach and best ways to work with Burmese patients?
Okay, I'll share a little bit about my experience because like I see that's really work. So I used to work at Barrington Health Center in almost Southside, closer to Southside, not in Southside, but over there when I started working there, it's just a normal clinic. You know, they have Burmese interpreter there, Burmese register at the SRS at the front, and it worked well. But one thing that changed dramatically is that, you know, before they come to an appointment, before they arrive at the clinic, they have to make appointment, right? They have to call appointment first. It's not emergency room, so they cannot just walk up to the clinic or hospital right away. So a lot of people don't, you know, and don't end up don't show up or don't make appointment even though they sick because they don't know how to speak or how to call. So HealthNet, I remember it was like 5 years or 6 years. I was the first person who would record in 3-4 different dialects because I speak Burmese, Hakka, Falam, and then where's the other one? I forgot, but at least those 3 I record my voice. So what we did was the phone system that we start. So when they call HealthNet right now, they'll say press 1 for English, press 2 for Hakachin, press 3 for Burmese. So, and then press 4 for Spanish. Yeah, I have my good friend Marta Romo. I think she's still there. She's like my mom. You know, she record, you know, we have very hard time. Nobody know how to record phone, but for the sake of our people, we have to keep recording our voice and we listen. I'm like, you know, I don't know. You know, this is what the patient will hear all the time, but we have to do it because this will help them. So that helped a lot. Like, you know, that's first day when when we play that you know, system, they were so confused, the Burmese that I know, they hang up the phone because they never hear Burmese in their phone line. So when they call like before, oh, thank you for calling HealthNet. something like that. That was a greeting. Now they say, thank you for calling HealthNet. Press 1 for English, press 2 for Burmese, something like that. And they say, oh my God, I think I got the wrong number. And then they hung up and they call us personal phone. They call our, a lot of our Burmese community is funny. We all know each other here and there. So they will call you your phone. If you don't answer, they'll call you on Messenger. If you don't answer Messenger, they will find a way to call you somehow. So they call me. I'm like, wow, I cannot answer while I work. But they say, is the help, they said like something wrong with the phone system because someone talking to me in Burmese. I'm like, no, that's nothing wrong. It is something that we started for you to have, easy access. And then, when we look at the first month of the phone call we received, it's unbelievable. How many people press the 2, or we have Hakka line, we have Falam line. Even though they all come from Chin State, they still will choose their own dialect if there is an option. That is what I want to say. If there is an option, they will choose it. So that is the first example. The second one is when they walk in to the clinic. Where I used to work, we have like 6 or 7 SRS at the front office. There will be one Burmese at the corner or here and there. The line is empty. The other 5 people who don't look like them are ready to assist, to check them in. But this Burmese group, will still line up to see that person who's only one at the corner to talk to her. Even though they wipe their hand, okay, next person come in, they say, no. The only thing they can say no, they rather wait for 15 minutes to check in. So that is what Rosie talked about, the comfortable level and the how do you say, the familiar face that's really important. So I feel like our phone system can help a lot when it's come to other immigrants or refugee to comfortable in our healthcare system, and then having registration person at the front as soon as they walk in that they can go to right away. And when they walk and waiting in the waiting room, it will be nice to see from the glass room or from the behind that someone that they can approach there. For example, medical assistant or nurse, whoever sit there at the back office, that's someone that they can familiar. It will really help. And then at the end, like someone that who can walk in to that room with the dialect that they can speak to talk to the doctor. I think if we can, I know it requires so many things, but if we can implement that, I think that will help a lot. And then it's work. I was working there for 5 years. It really works. So I know like IU Health is one of the top, hospital that we have that providing so many resources for our people. And we are so grateful for that, but I think we can do more. I truly believe that we can do more with the amount of patients that we have. Thank you.
Thank you. We just received a question in the chat asking if you could talk a little bit more about some of the Burmese customs that might be good for individuals within hospitals to know about.
Rosie, do you want to go, or Lian? I think you will know more about than us.
I can give it a shot. So I think it depends on very individual level. I think, as Justin was saying, recognizing individual as who they are is very important. But if we have to pick, some culture tips, I think any language, even Burmese language of something saying, Minglava, or something along the line of, smiling. Usually, I always emphasize the power in smiling. And that kind of approach that the Burmese, and I would assume every culture will like that. That would really make it comfortable for the patients. Rosie, do you want to add something?
Not really. I think you know better. So,
I can add something, so culture wise, we, it's so funny. We don't really use I love you and thank you in our culture. So, I said my mom sometime, me growing up half of my life in America, half of my life in Burma, I kind of know both by the grace of God. I'm so grateful for that. I mean, it was a challenge when you first arrived, but now I'm so grateful to have that experience because that helped a lot now. I said, Mom, I have hard time saying I love you to you because you never say I love you to me, but you don't know how much I love you. It's just so hard for me to say because we don't have that culture in, that kind of like a culture, in our society. And she said, you don't know how much I love you too, but I don't know how to say it either. So, that is our culture. And then sometimes, I like, sometimes they bought, like, for example, when I graduated high school, they bought a car for me to go to college. That is how they show their love, but they will not say it. That is just their culture. And sometimes, I said that's not their culture. That is our culture. And then sometimes we don't say thank you. A lot of time they will just walk away or just try to say something but don't say it out and walk away. So don't think that we are not grateful for your care or not grateful for your help. We are really grateful, but we just don't have this way of saying thank you in our culture yet. So we are a lot of younger generation helping a lot to our parents right now. Every time, like, let's say thank you. And then like Mr. Lian mentioned, when someone, like, for example, I have American staff in my office. So I teach them at least how to say, how are you? Mingalaba, Nadamo, whenever we have a client from our community. So even though this American who don't look like them physically, appearance, one day being greeted by them saying like, hello, Nadamo, Mingalaba, how are you? That means how are you? Mingalaba mean hello. They already feel comfortable and then ready to approach them and ready to ask questions. So that is other thing that will really help. And then one of the thing is that, even though winter time, we don't put a lot of, like winter clothes, or, a lot of time you may see one of our Burmese patient walk up to the clinic with flip-flop. So we are not used to this cold. We're not used to this snow. So, it's still, even though our parents, we've been here 15 years, my parents still don't have a snow boot. They just have a regular boot that they have to go to on snow. So they're not comfortable with that. So those are something that, you may see in winter time, like one of the Burmese family walk into your clinic or your room with flip-flop. Those are something that I want to mention. And then one of the culture that, I really want to share to the provider is that, when there is husband and wife walking into the clinic, okay, like I think Rosie was the one mentioned, women are very laid back. And then, a lot of time it's so sad that women don't have a say in our community for so long. They've been treated as a second class for so long. So even if you have the husband and wife, so you will witness a lot that the wife was the person who got sick, but the husband will tell you everything. So, like that is one of the culture that I don't know. That's what our culture is, but since I worked there for 10 years, I witnessed a lot. So sometimes I will step in and say, okay, now the doctor and I will ask a question to the patient. So sometimes I think it's okay to say, because our culture, women don't really have a lot of place to express. So that's why 90% of my staff are women. I want to change that. I want to change that. I believe women leadership. I believe they are capable. So, those are some example culture. That's one culture that I want to mention. And one last thing that I want to mention is that, a lot of us, like especially mothers, when we come to clinic, you will see, especially pediatric care, You will not see a lot of husband going to the appointment with their children. Most of the time, like the head how the head of the house is the father, right? Or we kind of say something and make a decision. But when it's come to going to school, sending off the kids, or taking the kids to a hospital, you will barely see the kid either. I mean, the father there. Most of the time, the mother will always take them. So I think, when you have something that you want to share to the family, women will be there all the time, but please know the decision still will make by the father when they get home. So that is not 100% all of them, but majority of them. So I don't know how to approach that and how to change that, but I think it's good to share. And I hope Lian and Rosie don't hate me for sharing that, because I think they agree that too.
Thank you. Thank you so much. This is incredibly helpful. So as you think, expanding a little bit on the conversation we're having about culture right now, I'm curious to hear about any beliefs or preferences you feel that the Burmese have, perhaps toward anything particular related to health. For example, end of life and end of life care. Thoughts about extending life or thoughts about hospice care. Is this something that that patients may have a preset ideas or beliefs about when they come into the hospital? Thank you for any thoughts you all have on that.
I think I can share a little bit. I think there's depending on, as we were saying earlier, the Burmese community is quite diverse religiously as well. And depending on the individual, of course, majority is Christians. And so I think Christianity is very similar, as to how prayers and, if toward the end of life, usually songs or, gospel or script or things like that will be a preference. And also, but for Buddhism's, I think it's very similar to, the Buddhists believe in the reincarnations and the life cycles. So usually, if we are to interact with someone of the Buddhists, they will want it to be peaceful. Toward at the end of life, or housewise, things like that, the care provider or the surrounding to be peaceful, and as well as the how do I say, the scripture, right? Buddhist preachings and things like that to be read to that individual. And the belief, I check, although I'm Christians, I have experience and check with a couple of individuals. The belief is that if someone is about to toward the end of life, and if someone is about to be disrupted by surrounding other person or things like that, that person is not free to move on to the next life, whatever that will be. I think similarly for Muslims, we do have a small percentage of Muslim populations here too. I think quite similar to that nature too. But ultimately, I think the understanding of the informations, I know it's comprehensive and complex as it is, hospice and the medical healthcare system itself in the United States is a puzzle sometimes. So the kind of walking through, communicating with the individuals or the community organizations or church or religious congregation that or family members that patient is affiliating with, usually is a good approach, I would say. And also the yes, I think kind of understanding, because as Rosie and Justin mentioned earlier, the healthcare system is, especially back in the days, I mean now, with a little bit in the past couple of years, there has been some development, some sort of a healthcare system. But before then, it wasn't, pretty much hospital is non-existent for most residents, especially in urban area. So understanding even as to insurance, deductible co-payments, which other companies, which hospital do what, how are the interpreters, connections, understanding to the topics. And there's a lot of things that, clients, patient has to adapt to. But I think the hospital, the health network, the hospital itself, and the physicians, the nurse, or healthcare workers, I think we are ever thankful for what you have done to improve the quality of life in the patients and the family, and also even leading talk show like this, not talk show, sorry, educational sessions like this is means how much you care for the patients and the client that will be potential in the future or currently or in the past that has been going through to IU Health. So I know it's a little bit expanded version, but thank you.
Yeah, thank you, Leanne. I want to circle back around. Oftentimes when we have patients who are in our hospital, oftentimes we think about who should be involved in the decision-making for that patient. So we want to be sensitive. And earlier we talked about the extended family, the larger family. You have the children, but I'm wondering what would be the role of grandparents concerning decision-making for, let's just say, a brand new baby, and perhaps a grandparent's role, grandmother's role for a brand new baby, or for the end of life. I'm thinking about the elders in the community. So can you speak to us about the role of various family members as we're seeking to provide a holistic care? Not only care for the patient, but seeking to have greater communication and greater cultural understanding on how best to treat that patient.
Thank you for that question, William. Usually the family social structure is involved. I mean, it varies, as diverse as it is. It's really individualized. I think I from the beginning we mentioned about, of course, general understanding of the culture is significant and important, but when it's providing the right service, it's the family, it's the individual of who they are. And so with that, I think usually in the, I would say, I mean, this would be my opinion, I would say, is that in Burma, usually decisions, if someone's sick or end of life, patients are not notified, generally speaking. It kept quiet and try to create as much, good environment. Always say, although they know that it's the end of life, they will hide it in a sense that to cheer up that person, like the patient. General cultural norm. It could change with modernizations and things, but here in the United States, I think it's the other way, right? I think that we patients and physicians, healthcare provider have that direct communications of to larger extents to this for the decisions and the status of the disease and so on, and then the family vice versa. But I think usually the whoever the head of the household is considered the parents. Parent is relating to husband, spousal kind of related relationship, and someone that's in the a needing of care or in that situations. I think the other spouse usually get to decide on or get involved in the conversations, and usually for the kids is usually both parents. I think, but the family structure is individualized and unique. So if the the husband is more educated per se and more understanding of the situations, I think the wife will agree to decisions of the dad. And then I mean the husband, vice versa. If the wife is which apparent to be trending to be that way and for the future, if the wife is more educated and understanding of the topics, the husband will usually agree to that. So I think really kind of and vice versa. So if it's related to someone's of the child, usually grandparents usually involve in naming of the child at birth. So those part of things, the grandparents usually love to get involved in, development of the grandchild, but the is a little bit distant for them to usually make that decisions. But at the same time, there might be some different culture beliefs as to who get to decide on, I mean, who should be a part of the government. So some culture or some tribe might, have fully respect to this individual, for example. So, informations are, it could be pastor, it could be someone who is highly regarded as, family members, things like that. That person will usually get involved in decision makings and things like those. Yes, hopefully that answer. Rosie, Justin, do you want to add something?
No, I think it's all answered. You answered it all. Yeah, very good.
Yeah, you answered. But one thing that I can add to that is when it comes to Anne's life, like I mentioned before, Burmese community are not aware of what is long-term care and what is hospice, like program. Those they are not aware. All they know is like there's clinic, there's a hospital setting. That's all. So one time back in college, I learned about acute care and what is long-term care, what is hospice care, and I was like, okay, there's those programs like for adults, like when they're going through specific situation, there's something that they can seek for their help and also for family. So I'm like, I went home and mom, do you know that there's this thing in America, there's those kind of programs and for older adults. And my mom's like, really? We don't know anything about that. I'm like, mom, it's not only you, it's even me. I just learned it from my college. So like I mentioned before, some decisions are made because they are not aware of there's something out there. When they're in that situation, they can get help or they can make like better situation or better decision. But since they are not aware about that or not know about that, so they still put the mindset and culture decision that they have back in Myanmar. And if we can make awareness or educate them about the program and this and that among Burmese community, I believe that they will have better decisions and make a better way to handle things. And back to Lian mentions, now when it comes to family structure, making decision in household, like myself and Justine and Lian family is not here, so I don't know about him, but Justine and me, since we speak English and more educated compared to our parents, in some decision, we make the decisions. We have to explain our parents this and that when it comes to health or regarding any issues that since we speak English and since we understand more of things going here, so we kind of make decisions for our parents in some area as well. So back in the days, it was like more grandparents and parents, but now it comes to a shift where children are leading and children are making decisions for their parents and for household, even though they're still young. So parents are more likely to lean on their children in making some decisions. Because like I say, especially when it comes to health, they have fear in them and they're like, they don't want to make a move, or they don't want to do things even if we told them. So we have to make phone call, we have to do paperwork for them. And so yeah, that's one thing. Back to culture, custom, yeah, children also more likely to involve in like making decisions when it comes to health situations.
Thank you. I was curious to hear a little more about the approach to Western medicine, to, for example, taking prescription medications versus doing some therapy that may be something that they would have done in Burma. Is there that difference that individuals experience? Is this kind of a shift in thought when you're here in the United States?
I would love to answer that real quick with my experience, but Rosie, it will be personal to personal, this one, because like person to person, I'm sorry, because and after that, and I think someone asked about mental health in Burmese community. That is what I'm really, I'm fine right now, but I will not say long. But you know, when it's come to medication, prescription, especially, when we first comparing to my family, I will speak on behalf of my family experience. You know, my mom is on like maybe 5 or 6 different pills right now. And my dad is like maybe 3. And before, like 10, 15 years ago, before my mom got stroke back in 2014. But before she got stroke and everything, you know, like when, you know, we visited, let's say, due to like a virus, we visited to the clinic and they gave us kind of like antibiotic or something like that. Sometime, I remember when I was young, high school, they don't pick up the medication. They say, oh, you know, like, we'll be okay, you know. And, you know, like, oh, because like they know this virus gonna go home, go on and stuff. But now, when they are really sick and when they are really, you know, when they know more about the system, they never miss picking up like medication. So what I do is I set up my own system, and then I have all my father medication list, my mom medication list, and they have their, like, they went to different hospital clinics, so they have this system that I have to go in and look my folder, you know, my chart for my dad and the other one for my mom. So sometime, you know, I set a reminder at least 5 days before their medication end. I time to refill. They always gonna let me know, oh, in 2 weeks, you know, in 1 week, you know, I need to refill. So I feel like it's come back to education piece. Before, they don't know how important it is to take a medication. But now, since they live here long enough and they know about, you know, how important to have medication regularly, you know, they kind of adapt the culture. That's what I'm trying to say. They now adapt the culture. So I think that is what I kind of know when I look at my family. I don't know Lian and Rosie had other different experience when it's come to medication, but yeah.
Yeah, I can add a little bit to it.
Oh.
So when it comes to chronic disease such as cancer, uncommunicable disease, you know, those things, yeah, like Justin mentioned, they're adapt to the system of American health. But when it comes to back pain or, you know, severe headache, they still think that they should not go and see the doctor or, you know, do something on their own, what they believe in back in Myanmar. So I still have few of them that I know, they have back pain and you know, like they're like, no, I don't need to go therapist, physical therapist, or like they just go to Asian grocery and get something, you know, but I don't know how to mention it. And they just apply to them and then give some massage and they think that they'll feel better. Or even if they have severe headache, I'm like, you need to go to ER or see the doctor as soon as possible. They're like, oh, you know, if I cook this and that and take it, it will be gone. So like just to mention, some population are adapting to American health system, and at the same time, there's some population still choose to make their own decision instead of seeing the provider and went to hospital. So yeah, especially with chronic disease, they are more likely to see the doctor. But when it comes to back pain, they don't know how our body works, lack of knowledge in that part, and severe headache or eyes infections or skin infections, they will still likely to go on their own decision. So there is something that I experienced within our own community.
Thank you so much.
There is a
I'm
question.
noticing we have about 5 minutes left, so I didn't want to miss Justin's thoughts on mental health. Would you like, or Leon or Rosie, and any of you, we'd love to hear.
Okay, so I will say
And just before you jump in, since we're real close to the very end, there was a question in there about COVID-19 and vaccines in general. So if you can combine those, that would be helpful as well.
Okay. So I'm sorry, guys. We love talking, and I'm so excited to see this many people listening about our culture and caring about our patient. That is, something that can describe how much I'm thankful for. So that's why, it took forever to finish. But COVID-19, yes, the beginning, we don't believe it as a community. We don't believe it, and a lot of people refuse to take vaccine, and that's why Burmese community, Chin Center, Hope for Tomorrow, churches, partnering with all the healthcare provider that we have, pushing them, coming back to, education, because we don't know, never been through this. Government never care about our healthcare system. Government never offer up a free stuff when it's come to healthcare. So we just don't believe in it. We don't know. So, but now by the grace of God, almost, if I'm not, I may be wrong, but 90 to maybe 100% of our people already got a shot. So when we know, and when we have enough people who are patient enough to explain us, we will never say no for something that goes for us, but we just don't used to the system. That's why we say no, no, no all the time. But after we learn about this seriousness and we all get the vaccine. So I'm so grateful for all the community leader, church. My pastor even talked about that on the sermon. You can trust God, but God can send you a vaccine so you can be healthy, something like that. I don't remember what he said, but that's saying a lot. So, so mental health part, I wish we can have another day to discuss this. How important about how, behind, how much we behind when it's come to mental health in Burmese community is that we don't even have the name mental health in our Burmese language. No Chin don't have that. We kind of explain or interpret in a closest way of understanding, but the Burmese, the real Burmese language itself, and then the Chin's dialects don't really even explain direct meaning of mental health. So that how far we are, when how far we are when it's come to mental health. So that's why, we are seeing more and more, especially the younger generation here in America who grew up in this, society. They got bullied. I got bullied when I was in high school. There are so many people feel treated different, this and that way, but we don't have a place or a system where we can express our feeling, the stress, that depressed, that we, expression that we have, because with the system and the community and the culture don't provide that. But now it's changing a lot. BACI, Hope for Tomorrow, and Chin Center and other churches kind of like start listening because they see their kids, the children been locking herself in the room for 1 week, don't want to come out. So they know something wrong. Even though they don't know what it is, they kind of curious. They kind of asking questions. So I think, that I will set that for the next time topic. If we have enough interest group of people, I would love to have Leon, Rosie, and all of you again to talk about this, because is something that I'm, something that burning in my heart right now, because we lost, I think we lost almost 3 to 4 youth that I already know younger than me in America, suicide in the past 10 years, but the community still don't know why. But we, the youth, don't know very well why, but the community, the people, the older generation don't know yet. So I will live with that. That's where we stand right now when it's come to mental health. So we have to do so much more work for that. Thank you.
Well, thank you so much. This has been an incredible an incredible session. We have learned a great deal from all of you and gained some important insight into the community. In some ways, it feels like just the start of the conversation. As you mentioned, I think there's a lot more we can learn. And so we may be able to come back and kind of think about a part two, because this has really been a unique opportunity. Thank you each. I'm going to let William lead us out.
So once again, I want to thank each of you, Rosie, Justin, and Leon, for this amazing conversation. Thank you for giving us a glimpse of the history that the Burmese people have been through and continue to go through, whether it be in Burma, Thailand, or other parts of the world. And even as they come here as refugees, and then you standing on the foreground, seeking to provide avenues or access for education, resources in the community. So I just thank you. I believe I'm speaking for the entire community here. Thank you from the bottom of our hearts here at IU Health for being present for us today so that we can learn much more, or learn from the very beginning what it means to be Burmese and seeing our Burmese family come into our hospitals. So thank you once again. And, you know, we've had conversations in the past where we had a part two, but I believe that we are right there. I believe we need to have a part two so that we can continue this conversation. So if you guys are open to that, perhaps we'll circle back around and invite you again for round two. So once again, thank you so much for being with us. There's one expression that I want to say, that we don't know what we don't know. And today there was a lot that we learned that we just did not know. Well, so thank you for opening our eyes and opening our heart to family members that perhaps we've never met before, but we are getting a glimpse into the eyes and ears and mind of the Burmese community. So once again, thank you.
Goodbye, everyone.